Thank you, Mr. Speaker. My question is for the Associate Minister of Health and Long-Term Care. I recently attended a meeting with the board chair and CEO of my Central East LHIN, where we discussed the LHIN's Integrated Health Service Plan. LHINs and service providers continue to roll out palliative care community teams, GAIN community teams, and other investments in home and community care. But despite these investments for home care, when it is no longer safe for Ontarians to stay at home, they deserve to know that long-term care beds will be provided for them. My Central East LHIN is in crisis. It has the lowest number of beds available and the highest number of those in need in Ontario. In Haliburton-Kawartha Lakes Brock alone, just one part of the LHIN, there are 770 people on the wait list for long-term care, and that list continues to grow. When will the minister deliver the promised beds for long-term care?
Thank you. Associate Minister of Health and Long-Term Care.
Thank you, Mr. Speaker. I want to thank the member opposite for her question. I also want to thank her for recognizing the investments we've been making in home care. Thank you so much for that. I want to assure her that in addition to home care, we continue to invest in long-term care as well. And it's because of these investments, Mr. Speaker, that the long-term care wait times in Ontario have been reduced by approximately 45% since 2008-2009. Investments such as 10,000 new beds that we brought online since coming to office, investments like the redevelopment of 13,000 beds that we have already made and we continue to make. The members opposites are asking me where? Well, let me give them some examples. How about this? October 30th, 2015, I was in Waterloo with the Deputy Premier and members of the PC caucus for the opening of a brand new long-term care in Waterloo.
Supplementary.
Mr. Speaker, the government keeps saying that they are going to address 30,000 more beds. At the recent Health Achieve conference, the Minister of Health spoke about change that's supposed to improve our healthcare system and provide better access for Ontarians. The Minister talked about closing the gaps between different areas and ensuring equitable access. You've had 12 years to review and develop a long-term care capacity study to ensure that there is equitable access across the province. We've been waiting for 12 years for that capacity study to make sure that the beds are where they need to go. So in Haliburton County, one of my homes needs to know when they will be refurbished and if they can get more beds allotted in order to make it sustainable, or they're going to leave that community. They may not stay.
Question.
So, Mr. Speaker, will the minister tell us when the capacity study will be done and if it will be done before the refurbishment plan so we know it's fair and equitable?
Seated, please. Seated, please. Thank you. Minister.
This is, Mr. Speaker, that we plan on redeveloping all existing beds. So we plan on redeveloping all existing beds. The program is open. We have reached out to all long-term care homes across Ontario that are interested in redevelopment to come to us with a proposal. A number of them already have. I look forward to announcing them in the near future. But I thought the member opposite might be interested in this particular redevelopment. It's Fairview Lodge, Mr. Speaker, and on September 25th, I was there for the reopening of their brand new, redeveloped long-term care home in the middle of Central East LHIN. Thank you, Mr. Speaker.